everyone, in this video session we're gonna discuss about stroke. Stroke is a brain attack. It can happen to anyone at any time. Stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissues from getting oxygen and nutrients. When this happens, the brain cells are out of oxygen and they begin to die. When the brain cells die during a stroke, abilities controlled by that area of the brain, such as memory and muscle control, are lost. How a person is affected by a stroke depends on where the stroke occurs in the brain and how much the brain is damaged. For example, someone had a small stroke may only have minor problems such as temporary weakness of arm or leg, and the people who have larger strokes may be permanently paralyzed on one side of their body or lose their ability to speak. Some people recover completely from stroke, but more than 2/3 of survivors will have some types of disabilities. Now let us discuss about the signs and symptoms of strokes. And the signs and symptoms of stroke varies from person to person, but usually the symptoms appear suddenly. As different part of the brain controls different parts of the body, so the symptoms will depend on the part of the brain which is affected and the extent of the brain damage. During stroke, every minute counts, and fast treatment can reduce the damage that can be caused by stroke. By knowing the signs and symptoms of stroke, you can take a quick action and perhaps save a life, maybe even your own. Sudden severe headache with no cause is a sign of stroke. Sudden numbness or weakness in the face, arm, or leg, especially on the one side of the body, is a symptom of stroke. Sudden confusion, trouble speaking, or difficulty in understanding speech is also the symptoms of stroke. Sudden trouble walking, dizziness, or loss of balance, or lack of coordination. The stroke treatments that work best are available only if the stroke is recognized and diagnosed within 3 hours of the first symptoms. If you think someone may be having a stroke, act fast and do the following simple test. FAST fast, where F stands for face, A stands for arms, S stands for speech, and T stands for time. For face, you need to ask the person to smile. Does one side of the face droop? If yes, then it's a stroke. And for arms, ask the person to raise both arms. Does one arm drift downward? If yes, then it's a stroke. And for speech, ask the person to repeat a simple phrase. Is the speech slurred or strange? If yes, then it's a stroke. And for time, if you see any of the symptoms, then call your doctor right away. Now let us discuss about the types of strokes. There are 3 main types of stroke, and they are ischemic stroke, hemorrhagic stroke, and transient ischemic attacks. It is also known as a warning or mini stroke. Most of the strokes are ischemic strokes. 87% of strokes are ischemic strokes. Ischemic strokes occurs when a blood vessel carrying blood to brain is blocked by blood clot, and this causes blood to not to reach to the brain. High blood pressure is the most important risk factor for this type of stroke. Ischemic stroke can occur in 2 ways: embolic stroke and thrombotic stroke. So first of all, let us talk about embolic stroke. A blood clot or the fragments of plaques are formed somewhere in the body. Usually they are formed in the heart and travels to the brain. The clot in the brain now travels to the blood vessels, which are small enough to block its passage. Clot lodges there, blocking the blood vessels and causing a stroke. About 15% of embolic stroke occurs in the people with atrial fibrillation, and the medical term for this type of blood clot is embolus. Similarly, we have thrombotic stroke. It is caused by blood clot that forms inside one of the arteries supplying blood to the brain. And this type of stroke is usually seen in people with high cholesterol levels, so the medical word for this type of clot is thrombus. 2 types of blood clots can form thrombotic stroke: large vessel thrombosis and small vessel thrombosis. Large vessel thrombosis is the most common form of thrombotic stroke. It occurs in the brain's larger arteries. In most of the cases, it is caused by long-term atherosclerosis in combination with rapid blood clot formation. High cholesterol is a common risk factor for this type of stroke. If we talk about the small thrombosis, this type of stroke happens when flow of the blood is blocked to very small atrial vessels. It is also known as small vessel disease or lacunar infraction. This type of stroke is closely linked to high blood pressure. Now let's talk about the hemorrhagic stroke. Hemorrhagic stroke happens when an artery in the brain leaks blood or ruptures, and the leaked blood puts too much pressure on the brain cells, which damages them. High blood pressure and aneurysm balloon-like blockages in an artery that can stretch and burst are the examples of condition that can cause a hemorrhagic stroke. There are two types of hemorrhagic stroke, and they are intracerebral and subarachnoid hemorrhage. Intracerebral hemorrhage is the most common type of hemorrhagic stroke. It occurs when an artery in the brain bursts, flooding the surrounding tissues with blood. And the other one, that is subarachnoid hemorrhage, is less common type of hemorrhagic stroke. It refers to bleeding in the area between the brain and thin tissues that covers the brain. And the last kind of stroke we have is transient ischemic attack, TIA. It is sometimes called mini stroke, and it is different from the major types of stroke because blood flow to the brain is blocked for only a short time, usually no more than 5 minutes. You can say it is a medical emergency just like a major stroke. More than a third of people who have a TIA and don't get treatment have a major stroke within 1 year. As many as 10% to 15% of people will have a major stroke within 3 months of TIA. Recognizing and treating TIAs can lower the risk of major stroke,